spotlight on regenerative medicine. Doctors, any comments?
I just think it was nice to see developing different technologies, but see your approach at the very end, kind of combining everything into one place where physicians can kind of visualize how they're going to add all these products into their practice and how patients will benefit from them. But I think exosomes is kind of like the biggest misnomer, and it's confusing for a lot of surgeons and other practitioners because we've been approached with so many different products that claim to have magical properties and be an exosome, and we really don't know what all those things mean. I was talking with a few scientists involved in the process, and I think that the concept is it's basically a bag of mixed nuts, what we have right now. And some of us want cashews, some of us want, really nice almonds. And so we're always trying to figure out how do we separate out the products, the signaling molecules that are the most effective for the purpose that we want to use them for. And we see results on stage that show hair regeneration, skin improvements, tone, texture, quality, all those things. But how do we separate out the indications that diagnose the problem and then find the right treatment? I think that's the most confusing thing for surgeons and practitioners. And I think just now we're starting to see the one or two or maybe three really great companies coming to the surface, great technology that's been presented on stage, showing real data backing up what we're finding. So, I think there needs to be a discussion about not just the concept that exosomes work, what are they, but how do we monitor them? Are we going to create whole new systems to identify the quality of the product that's there and standardize it and standardize the treatment protocols?
Your thoughts?
Yeah, so it's been amazing just to see all the different technologies evolving over the last many years. And I know initially when I first started practice about 14 years ago, the gap between what we can achieve surgically and non-surgically was fairly broad. And it just seems like over time that gap is narrowing and narrowing more. And I do think this whole regenerative medicine space is really further helping us to close that gap even faster. I think we still have I'm excited to see how over the next many years we continue to evolve this, whether it's either through more innovation, whether it's playing around with different delivery methods for how we utilize these products. But I know that it's making a difference in our own practice in terms of closing that gap between what we do surgically and non-surgically.
So I'm supposed to be moderator, but I'm also a discussant, so I'll make a couple comments. One of the things that we learned or should have learned in the early days of stem cells, which I was fortunate enough to participate in, was, we're doing these FDA tests, and yet everyone's DNA is different. Yeah. So, and we're not measuring that. So, for instance, one of the studies that we did that showed in patients over 55, their decline after fat grafting was to about 20% at 2 years volume retention, versus in younger patients under 55, almost an 80% improvement. So one of the key aspects, I think, is the youth of these exosomes. So in other words, younger exosomes likely will perform better than older exosomes. So if we're liposuctioning 30 to 40-year-olds versus using platelets, for instance, and I don't know what age group they use, I'm just throwing this out, in an infant, likely they're going to be more effective. That's number one. Two, we're learning that these exosomes, we have to know what's in the particles. And so the critical thing is really data. And again, anecdotal studies of 20 patients is not giving us the data. The FDA studies that Rion are doing are going to be very important because these may lead the way. The other thing just that becomes confounding is an amazing study out of the University of Miami using allogeneic stem cells from human cord blood showed that if you used placebo 100 million cells versus 200 million cells, what was interesting is you expect better results with 200 million cells, but that was not the case. They were giving this IV for frailty of aging, and 100 million cells outperformed everything. Not only statistically significant improvement in all performance characteristics, cognition, muscle strength, inspiratory, expiratory volume, but all of the biomarkers of inflammation and age in cells were better with 100 million, not 200 million. So again, more confounding factors. Hence, it's so important that we do comparative studies. And I know that our group has tried very hard to look, for instance, at what is the difference between a hybridome and exosome? Well, they're markedly different products, and one is much more effective. So we have to characterize it. It's not a black box that somebody gives you and you use in your office and go, this works, because it won't work on everyone.
Right. And the concept of a hybridome, so I wrote an article where we looked at fat transfer with platelet-derived growth factors and exosomes. And when you use a multimodal approach, using a fat cell, for instance, as a continuing factory for the angiogenic factors, in conjunction with those factors for hair, it's much more effective. I think that we're going to see multimodal treatment strategies. We're going to stop saying exosome. We're going to probably drill down on much more specific words and language, and we're going to be using things like peptides, which are pegylated to circulate without needing a liposomal derivative in order to have much better function over time. But I wanted to make just two other key points. The landscape for exosomes, or topical and penetrating therapies, at this point reminds me a lot of what we saw with semaglutide in the early 2000s. There was a lot of ups and downs. There were products that they were trying to bring to market with unknown side effects, and now they're basking in the glow. And I think that in about 10 years, maybe 20, exosomes and, let's say, topical derived therapies will probably outpace everything in the non-surgical market at this point. So I think it's at a tipping point right now. And thank goodness for companies like Ryan and Benev and a few others that are really pushing the scientific envelope, because I think that it really will. We know, if you're a facelift surgeon, you know that one of the most powerful things you can do is to prescribe a topical vitamin A derivative for your patients, because we can do a lot of surgical things, but improving skin quality just makes those photos look so much better and really does help the patient's quality of life at 3 and 6 months. So imagine the targeted therapeutics and how those will be much more powerful, like your slide.
No, I would totally agree. And I think we've already talked in the last presentation about a lot of combination therapies. So I think the whole regenerative space is going to be part of the new norm in terms of what we do, whether it's for facial rejuvenation, whether it's for below the belt type rejuvenation as well. So I'm excited to see where the future goes.
The beauty of this field is, you start to treat patients dynamically. We know growth and development, and then at age 22, basically tissue decay. So we're literally, with these kinds of treatments, we're slowing tissue decay. So you're not just making people look better, you're actually changing the age of their skin cells, for instance. And these are completely new concepts that have to be gotten across, because, again, you're going to have one black box and you're going to have another black box. They do not do the same thing. So when you say that didn't work and you throw it out, you need to be making sure you understand what is the contents of these black boxes. And I think that's a very important aspect in this field.
And as a quick note, it has to be, so FDA is the main issue is regulatory hurdles right now, because, we need good science to get past regulatory. And like you said, and that slide showed us earlier from Benev, there have been many bad actors in the space of exosomes, companies that have come and gone basically overnight. So we do need some sort of, I think, focus on regulatory mechanisms and looking at ways to screen, like what your company is doing.
And we have to be careful, because currently there are no approved human exosome products. So
right, but also platelet-derived products, and even the use of PRP is not approved for injection or for penetration of the skin. And that is also something we all do in our clinics on a regular basis. And I think we can all agree that there's a step where physicians don't want to get ahead of themselves and put themselves at risk. But plastic surgery, I think, is uniquely positioned because we are early adopters. We do push the limits of technology, and it's the different independent investigators in this room, the Grant Stevens of the world, that help to innovate and create new technologies and bridge that gap, that then allows us to kind of go to that next stage. And we have to keep pushing.
No, I would fully echo that, and I don't know. I'm excited the way the direction we're going. I do think data and science is going to be the backbone for how we filter out the bad actors from the good actors out there, and so I'm excited.
All it takes is one bad mistake, and it can totally screw up the whole landscape for everybody. And we've seen that, and we just saw that there's a med spa where they had 3 HIV cases from PRP-based facial. So all it takes is like one exosome company posting something online with a physician, and then somebody gets a skin cancer or something, 5 years later, and it'll be in the news, and we'll all be sitting there scratching our heads like, this is a multi-billion-dollar industry with real outcomes that can help patients. So we just have to be thoughtful. And how do we avoid that? I think it's through better science and a clear and concise message to the consumers and the physicians.
I think those are excellent points. I know that this has been mainly a panel discussion, but are there any questions from the audience? Or any thoughts or comments from any of the presenters? This one.
You're talking about exosomes, leaving out one young or young. But you're not talking about word jelly. There's no science that doesn't say that's the number one source. So no one's even mentioned Mike jelly.
What?
Yeah.
Yeah, there.
And also saying that that people aren't using it legally now. That's not true. FDA approves it for right to try. There is also exosomes that are exempt. So you're talking about a field that frankly, none of you know much about.
That may be fair. I think that none of us knows much about exosomes. I think that what you're saying is there are different sources for the production of exosomes. There are quite a few. And there are compassionate use exemptions in the FDA right now. That's where a lot of the trials are focused. And Ryan's running one right now that's doing pretty well. But I think that what I was saying earlier was that exosomes is such a broad category. Are we talking about PDGF-related compounds, FGF, VEGF? Are we talking about long-acting liposomal formulations? Or are we talking about peptides that come from the exosome itself?
Exosomes only have one definition. Exosomes only between 40 and 140 nanometers, average 100 nanometers. They're a type of extracellular vesicle,
right?
But they're unique. Every source, Wharton's jelly tissue is the best source, but every source has different characteristics. So you can't talk about exosomes. There are plant exosomes that don't do anything. All kinds of exosomes, but you really shouldn't be talking about this unless you have people that in this area.
Actually, just to correct you, plant exosomes from the rose, for instance, have been shown to be effective. We've looked at 100 plant exosomes, and we've combined them, and we have found them to be almost as effective as bovine and almost as effective as human. So I have to disagree with you. Are you part of a company?
Pardon?
Are you part of a company?
Yeah.
Could you identify that so the audience is aware?
Michael Crowley.
Pardon me?
Michael Crowley. I'm the owner of the Crowley Center for Regenerative Biotherapeutics. We're the largest producer in the world of Wharton's jelly exosomes and stem cells. And we entered this market scientifically. The science shows what we do. We have the best product. It's medical grade. We work with physicians all over the country, but the regenerative medicine physicians.
So Ryan has shown FDA studies. Benev has shown multiple studies. Your publications in how many patients? And these are FDA-controlled trials?
We've just done a trial ourselves of 100 patients, which we can teach you about. But, this area is that the plant exosomes compared to Wharton's jelly exosomes, there's no comparison. Why use them?
Did you do a study on that?
Well, there are plenty of studies right now.
So now you have published studies comparing...
There's 11,000 studies of stem cells and exosomes.
I don't want to argue, but this is the point with the problem why this is bloody water, because you get up and say something is best, but you don't have any comparative data to say that.
If you want, I'll send it to you and you'll find out. Just read the studies. There is no scientific debate that Wharton's jelly isn't the best source of stem cells and exosomes.
So as we can see, it's a very contentious field, the exosome, field. And I would say because we lack definitions, we lack standardization, we lack the tools and the nomenclature to communicate about our outcomes, about how we define a successful outcome, and about how we, basically prove that to the community that's around us. And I think that there's plenty of time and space to develop that, but we clearly need to set up those key endpoints and make sure that we're presenting it in a way that is responsible.
But there are PhDs in exosomes that could be here too.
Well,
I don't happen to be that.
You have several scientists that just presented, and I'm looking at comparative studies, and that's why I ask you. So
I can send you the studies. They're all.
I don't think we have a leading source yet. That's all.
That's totally false. Totally false.
Well, we appreciate your perspective.
All right.
Any other comments from the panel?
No, I just think that it's a burgeoning science, and I think it's fun for me. I'm an MD, PhD in bioengineering, Rice University, and I've been involved in patenting peptides that are pegylated for circulatory tissue engineering, all those issues, and I'm just so excited as a young scientist and surgeon to see how what we're learning about cell signaling, senescence, anti-aging can actually be used at the bedside. How we're translating, and you're a great leader in that specialty as well, but how we're translating these bench side discoveries into bedside care. And that's why I did an MD PhD in a medical scientist training program. And so it's odd to me that being a cosmetic surgeon, I'm on the forefront and lucky enough to be in a group that's helping to really help patients at that basic level.
Yeah, and I'd echo that. I also have a research background as well before med school. So when I look at these different technologies, I'm always looking for the data and the science and trying to figure out what stands out from the rest. And the exciting part being a clinician or a surgeon is that we get to incorporate these into our practices, see what it actually does in people's hands. And for me, it's like this continuing learning journey. So I'm excited to be in this space.
How Daniel would you describe or compare stem cells to exosomes? How would you present that to the audience to help them differentiate those two?
Well, exosomes are basically the small packets of information that get shed into the media that we grow stem cells in. They circulate in our bloodstream and help us to regulate all of our cellular function. Stem cells are basically like the little factory that creates those signaling molecules. And like you alluded to, their age is very important in terms of what they produce. And I think that the early scientists, and one of the most well-known scientists, no relation, Stephen Jay Gould, has been around for a long time talking about how those signaling packets, the exosomes, are so critical. And I think that actually exosome science probably came before what we know about stem cell science, but the two are interrelated. So we need to have the factory and we need to have the signal. The signals can be just as valuable as you've shown as the factory. But I think like Acorn Biolabs and a few of these other companies are showing, the younger we can get the cells, the better. The more we can produce from them, the better. The more we can understand from them, the better. And I think banking is going to be huge in the next 5-10 years because the best discoveries are 10-20 years away.
Any comments?
No, I would echo that. And that's my understanding of exosomes and how they differ from stem cells as well. And I loved hearing what Drew had to share about Acorn and the age at which you harvest. And I'm thinking maybe I should get my kids all harvested as well at this age so that they're well prepared for the future. So
it's a very bright future ahead of us. I think that, one of the things that we have to realize is as we get older, we deplete our stem cells. So we need to really be thinking not just about exosomes as a transient therapy, but we need to be thinking about how do we maintain and restore stem cells. For instance, some of the devices where Nuvion was presenting something where there was more recruitment of stem cells. Diane Duncan has done some beautiful work looking at sarcopenia and preservation of muscle stem cells, because again, without the stem cells, we kind of need a combination of both. We need our stem cells producing our own exosomes and exogenous sources of both of these. How would you look at that comment?
Yeah, multi-tiered approach, also genetics, mRNA signaling molecules and other kind of new advances that we're seeing are also key. But we've seen the power of peptides. We're seeing that kind of rising and changing. Now people are offering all kinds of peptides in their practice, including the glucagon-like peptides and Semarelin, all these other great medications. We've seen the value of fat, but only in the last 20 years have we really been able to standardize it. And I think facial surgeons are really kind of on the forefront of that. But the exosome is just another part of that. And like I said, I really think we need to, at some point, we're going to stop saying exosomes. We're going to say something like, the VEGF-derived peptide that comes from this. And then we'll be having conversation about neovascularization, or there'll be something that'll be a fibroblast-derived growth factor, or, any of those things, FGF, PDGF, all those factors. And then we'll be much more specific in what we're finding. And we'll find that some activate stem cells, and other times the stem cells in conjunction with exosomes have synergistic effects on the end organ.
What are you guys worried about with these? Any adverse events that you're concerned about or that the audience should be aware of?
Yeah, I'm the most fearful of the adverse events because of what we said earlier. So the biggest problem right now is using the product and putting a video of yourself doing a CO2 laser and then squirting it on the surface of the skin. You really should not do that. And the reason why is because it's not FDA approved for that, and there could be a problem, and then it's going to create like a lot of murky water. I think that topical use is great. Compassionate studies are the best and most important, but making claims that fall outside of what we can claim at this point, which is basically nothing, is not responsible. And I think that as physicians and as a industry, we owe it to the patients to really get the investigation done first.
So more human trials versus what we see in the lab with various techniques.
Yeah.
Yep. Well, we're getting close to the end. I think we could probably, unless there are any other comments from the audience, I think we could probably end it here. We only have a few minutes left, so thank you all very much for the opportunity.